All right, here we are back again. Hey there, everybody. Sending out peace and love to you all. Hope that you're doing well wherever you are, whatever you're doing. I hope that you're finding yourself as being blessed because you definitely are. So, we're here today. What is today's date? The third, 12th, 12th, 21, December 12th, 2021. And here we are back for another live broadcast on Facebook, on YouTube, and eventually I'm going to have to do this simultaneously again with Instagram as well. But we're here for another session. Sometimes we're sharing information. Sometimes we're delivering a message. Sometimes we're offering healing. Today is really more so along the lines of sharing information and offering some healing for anybody who ends up deciding to come by and check it out. We certainly are making that available today. So we're dealing with physical pain. If anybody has any physical pain, regardless of the trauma, excuse me, regardless of the cause, if there was some type of physical trauma that took place, some type of injury that happened, if a person is, perhaps considering surgery, some things that's worthwhile for you to consider, and we want to offer you some support. Okay, regardless of which of those might be, kind of troubling you, or if there's some combination thereof, or if you are even dealing with some things on an emotional level, maybe with the stress of the holidays, um, maybe missing loved ones, whatever the case might be, we're here to offer you some support, and we're more than happy to do that. So let's talk about physical pain for a moment. So physical pain in itself always has some cause, something that caused that pain, right? It could be that a person stubbed their toe and they're experiencing pain in their toe because they stubbed their toe. There was some trauma that took place as a function of that. Maybe there's some inflammation that's developed as a function as well. A person could end up feeling some pain somewhere because of some infection that's taking place. The infection in the body may be adversely affecting in the body, such as in such a way that it's causing deterioration of a certain part of your body. And that could certainly be painful. There could be physical pain that could be the result of just disease that's impacting the body, whether that's cancer or arthritis, anything, by the way, that ends with an itis, whether it's um, laryngitis, arthritis, anything that ends with an itis is always going to be a case where there's inflammation going on. Curly Conscious King, hello to you, my brother. Good to see you. Good to have you here as always. I hope that the day finds you well. Still looking to hear from you, by the way. Um, so definitely feel free to reach out either on Facebook at Royce Fletcher Thomason, or on Instagram at Royce Fletcher Thomason, or Instagram at Transcending the Matrix. Um, and we're certainly happy to connect with you. And anybody else who's here, feel free to chime in. Just let us know in the chat that you're here, in the comments that you're here, or say hello. Whatever the case is, we're certainly happy to have everybody who shows up, and we love to acknowledge your presence. So if you would do that solid, we'd appreciate it, and we'd like to be able to say hi. At any rate, so there could be a variety of different issues that are taking place within the body temple that results in the physical body experience of feeling some physical pain in the physical body. You said you reached out to me on Facebook Messenger. Will and we'll follow up on IG. Um, okay, I'll have to. I When did you reach out on Messenger, and what name was it under, if you feel comfortable sharing that. It's possible that it went to a totally different folder. Somebody actually sent me, I spoke with somebody the other day that actually sent me a message. The message showed up in this weird folder in Instagram, but they actually sent it from Facebook. So I have no idea how that even happened. But I'll definitely look into that. And I'll explore if there's some other folders other than my main folder that might have some message in it. Um, I'm not sure exactly why that happens sometimes, but maybe if we're not connected already, maybe that's what it does. I'm not sure. Um, but yeah, definitely please reach back out, or even drop in the comments who you reached out as, or what the name was that you reached out under. Last Sunday. Um, okay, this was on. Um, okay, all right. I'll look into that and see and I'll see what I can find. I'm pretty sure it didn't go into my regular inbox, so I'll have to check and see if there's some other folder um, where things are sent. And also, if you reached out on Facebook, if you would please send me like a friend request or something, because that might have something to do with how well the the message actually reaches me. But I'm going to make a conscious point to look into that, since you mentioned it. I'm glad that you did mention it, by the way. Okay, so where were we? We were talking about different things that can cause the body physical pain. And yeah, there are a variety of things that can result in physical pain in the body. A person can actually have a surgical procedure, which is um, trauma to the body that will result in pain. The body being cut open and things of that nature. And there's some things I'll talk about specifically dealing with surgery as well. Um, but what I want to say for all of us, that pain is a symptom. Pain is a symptom of something else. There's something going on that results in pain. And whatever that thing is that's going on, whatever shows up that results in pain is really an indication that something else needs to be addressed. Here's what I mean. I gave an example earlier of if somebody stubs their toe, that could end up resulting in the pain. And if I say a person stubbed their toe and their toe is hurting, what would you say is the cause of their toe hurting? In all likelihood, you'd say is because they stubbed their toe. On a certain level, that is true. Stubbing their toe was a function of the pain that they ended up feeling, or the pain that they ended up feeling was a function of stubbing their toe and whatever trauma was inflicted upon the body, whatever injury took place as a result of that. That's true. However, what is the reason that the person needed to stub their toe? That's what it is that is the deeper thing that needs to look at. And I'll give you an actual example. Okay, there was somebody, this was some time ago, who um, had been limping for a few months. I think it was like 3 months or so. Had been limping, and what it is that was kind of connected with that limp was obviously pain. Usually, if somebody is limping, it's because they've got some pain, right? In this case, it was the person's ankle, specifically their left ankle, right? There's significance to that, by the way. It's specifically their left ankle. They had been limping for about 3 months at the time that we crossed paths. And what happened immediately before this situation where they end up finding themselves in pain and limping as a result, to kind of relieve some of the pressure that would take place when stepping down on that foot or on that ankle, is that there was a bike accident. And in the bike accident, sprained the ankle. Okay. So this left ankle was sprained during the bike accident. If she were to have gone to the emergency room or gone to the doctor, it would be rightly identified um, that there was a connection between this trauma that she experienced and the pain that she was experiencing, right? Okay, it wouldn't be it's not rocket science to figure out that somebody fell off their bike and perhaps sprained their ankle. They could determine that it was sprained or strained or whatever the case was. Um, and how would they begin to treat that? Maybe they would put it on ice. Perhaps they would have her elevated to keep there from being an excessive amount of blood flow to that area, so that that wouldn't contribute to the inflammation. They could maybe give her some anti-inflammatory medication. They may wrap it. They may give her something to put on top of it, a salve or something to put on top of it. And all those things are fine. However, even having experienced that, 3 months later, she's still limping. Okay. And it's possible that the issue could have been resolved ish um, during the span of that 3 months, or even in a week or less. But in her case, it wasn't. Okay. So, what it was that I had to determine wasn't what caused her to experience this pain on the physical level. What caused her to need to have that experience in the first place? And so, yeah, her ankle was hurting because she sprained it. She sprained it because she had this little accident on her bike, right? But I've got to look at the deeper thing. The reality, from my perspective, is that it was an injury that was waiting to happen because there was something else that was unresolved that needed to be addressed. Okay. And the way that things work out is there's sometimes situations where there's an imbalance within us spiritually. And if it doesn't make itself, if it's not adjusted, or if it's not clarified or resolved there, it'll make its way down into the mental and the emotional realm. Okay. To get our attention, because we tend to pay attention to the things that where we focus our attention, right? Okay. And if we don't get it cleared up there, it has nowhere else to go but get to the physical body. Okay. If it's showing up in the physical body, it's showing up as a messenger to us that there's something that needs to be addressed, cleared up, resolved, taken care of. And so, in this particular case, there were some questions that I asked the person, and it turned out that it was a long-standing issue. Long-standing issue. The lady she'd been on the earth for several decades, and and I don't remember exactly how old she was at the time. I feel like it was in her late 40s. But at the time of us crossing paths, I looked at a few different factors. I looked at the fact that it was her left ankle. I looked at when the injury actually took place. And as a result of some questions and some investigating and some things that I feel like I was guided to look into and to explore, it turned out that there was a connection between this pain that she experienced in the ankle as a result of the trauma that she had in the ankle as a result of the bike accident she had, where she sprained her ankle, to something that had happened a long, long time ago. Kenya, greetings to you, my brother. Good to have you here. And so, what was it that took place? Well, uh, when she was born, she had two older brothers, like my grandmother. When she was born, she had two older brothers. And when she was born, she became the baby and the only girl. Also, like my sister. I have a sister who was born. When she was born, she had two older brothers. My brother and I, Damien, who I went Uh, he and I are 4 years apart. And then several years later, she was born. Well, when she was born, she was the only girl and she was the baby. And those are two significant places to be. That's a special spot. That's a special spot. And such was the case with this lady when she was born. She had these two older brothers, but she was the only girl and she was the baby. But something happened a year and a month later. What might that have been? Another girl was born. And at that point, she was no longer the only girl nor the baby. Excuse me. And so there were some things that happened as a result of that on a deep subconscious level. Now, again, these are grown folks in their 40s, as I recall. Greetings. Oh, good to see you as well, my brother. Good to have you. Um, and so the reality was that there was in that little girl, several decades before, in that little girl, there was still some unresolved things as it related to her sister coming and stealing the show a little bit, right? By being born. And um, it wasn't that she had a bad relationship with her sister or anything like that, but there was something deeply subconscious going on that needed to be addressed. And so we addressed that. And what happened as a function of us addressing that in that session? She walked out for the first time in 3 months without a limp and with no pain. Okay. Because there's always something going on that's deeper than what it seems. That's something that I learned a couple decades ago. Okay. That there's whatever is going on physically in the body, there's always something deeper that's going on that's the cause of it and that can be addressed and resolved. Okay. And so, what I want to say out there to anybody, and I want to check in with you all. How are you all doing out there? And is anybody experiencing any physical pain, any pain anywhere in your body, whether it's back pain or, or shoulder or knee, old sports injury or, um, arthritis or any kind of issue where you're experiencing any physical pain in your body? Could be from, you know, being on your feet too long or whatever the case might be. Pardon me. I want to check in with you all and see if there's anybody here who is feeling any physical pain at all. Because if so, we're going to address it on the spot, just like we did last week. And um, person started out with a pain level, back pain level of 7 on a scale of 0 to 10, with 0 being no pain and 10 the most excruciating imaginable. Um, and within a span of 6 minutes, that pain went from a 7 down to 0, down to nothing, where she was completely free of that pain. And if there is anything that anybody is experiencing physically in terms of physical pain, we'd like to address that with you today as well. Um, I'm happy to do this, and people don't have to, you know, be riddled with pain in their bodies. Okay. Um, there are things that are available and that don't have a negative impact. So we're more than happy to offer to lovingly offer support in that area, um, and allow you to experience some relief. Uh, as was said in an old Shakespeare play, there's more in heaven and earth, Horatio, that is dreamt than is dreamt of in your philosophy. There's so much more out there that we don't necessarily know sometimes is even available, that can be of support to us. And That's one of the reasons I come on here and I do this. Um, because there are options available, options that don't have any negative side effects, options that um, are 100% completely safe and effective. All right. And so we're talking today about physical pain, or trauma, or any type of physical injury, and wanting to just offer some insight, some information, some understanding, and some support, so you can actually be free of it. Anybody who's considering surgery, a lot of times people actually end up going through surgery because of a pain that they're feeling in their body, and uh, that is an option. That is an option, and for the most part, the way that Western medicine deals with maladies in the physical body is to uh, either uh, cut or prescribe, either perform surgery or give you something to take. All right, and those are options that are available. There are also other options available too. And if this lady, in this case, if she had had surgery on her ankle, for instance, that might have been able to have helped to some degree with whatever was going on with the sprain and such. However, it wouldn't have addressed the root. It wouldn't have addressed the root. You may have something in your garbage that's beginning to generate an odor. Okay. And and you may light some scented candles. You may light some incense. You may spray some Febreze or some Lysol. You might um, you might do a number of different things to cover that smell, right? You might do several things to mask or cover that smell. However, it hasn't gotten rid of the smell. You might not be aware of it at the time, but it hasn't gotten rid of it. And after a little while, the issue is going to come back. The way that you need to get rid of the smell is to get rid of the cause of the smell. In other words, when you remove that which is causing the smell from your home, you take the trash out, then what the root of that foul odor will be addressed and taken care of. Okay. In a similar way, there are things that we do a lot of times to mask pain. Like pain medications don't get rid of pain. What they do is they send a signal to your brain where your brain doesn't register the pain. It doesn't get rid of the pain. And like a lot of times, there are people who have back pain. They may have back pain because there's been, um, the way the body works is uh, pain is actually registered. Physical pain is registered through the nervous system. Okay. So the nerves are kind of an electrical system of the body. They send signals to the brain. Okay. And that's where the pain is actually processed. All right. And so there could be situations where something happens and there's pressure placed perhaps on a nerve, or there's something that's going on and a signal is communicated to the nerves, which transmits that to the brain, and the brain processes it as pain, right? Okay. Now a person could have a situation, for instance, where part of what protects um, part of the nervous system is our spinal cord, right? The nerves that go, um, the central nervous system essentially consists of the brain and the spinal cord. All right. The spinal cord runs, throughout the course of your back, your spine, and it's protected by the various vertebrae. All right. And there could be situations where there's been okay, so there's the vertebrae. And then between the vertebrae, there are these discs that actually serve as a cushion so you don't have bone rubbing against bone. All right. And so there are situations that can occur. It could be from injury, it could be from a number of different things that take place. It could be from some type of trauma, it could just be from wearing it out over a process of time. where a person might slip a disc. You've perhaps heard that term before, or there may be degeneration of that disc to where um, the bone is at a point where it's rubbing against bone, which can be very physically painful for a person. Well, if a person, is taking, um, if a person, for instance, is taking a pain medication, whatever that medication might be, um, it helps to inhibit the experience of feeling that pain, but it's not keeping the bone from rubbing against the bone. And so sometimes you might hear people say, people who might have a condition such as, a lot of back pain that they experience. And then, they take medication and they feel a little bit better. But then you may hear them say, oh, I think I did too much yesterday. I'm feeling this pain flaring up. And what it is because they've had this kind of false sense of security because they're not feeling the pain. They think they're okay. And so then they do things that actually cause further stress to the body, and that bone is still rubbing against the bone, for in the case of this example. And then there's further deterioration, there's further damage to the body. And so while the pain hadn't actually gone anywhere, a person was just numb to the pain. The pain was masked. It wasn't eliminated. It wasn't resolved. It wasn't. The pain was managed, but it wasn't cured. It was. It was masked, but it was not. It was not eliminated. I'll put it that way. Okay. And so, what we deal with is really getting to that root cause of the issue. And sometimes a person will have a surgical procedure and that will do some things. A person can have a surgical procedure and have a knee replaced, for instance. Okay. A person can have a surgical procedure and have vertebrae fused together so that they're not rubbing against each other. Okay. A person can have a surgical procedure and, this or that done, something stuck in or something cut out that can have some level of impact, but it's still not addressing whatever that root of the issue actually was, whatever the root cause of the issue actually was. And we want to be concerned with addressing the root cause. We want to alleviate, we don't just want to spray Lysol or Febreze when the trash is stinking. We want to find a way to take it out. Okay. We want to find a way to address it all together in a way that's going to be long lasting and effective. All right. And so even with surgery, as a function of surgery, for instance, there's trauma that happens to the body as a result of that. Not only the skin being cut open, muscle tissue being cut open, whatever else is happening in the body. When the After the surgery, there's trauma from the surgery. There's also scar tissue that builds as a result of the surgery. Where when there's surgery, there's a scar that's left as a result. And you may not see it on the outside so much, but there's some scar that's left. There's scar tissue that's generated. Sometimes people dealt with a lot of people who've had a lot of back pain over the last 20 something years, a little over 20 years. And there are situations where people have had multiple surgeries on their back, for instance, and then they get to a point where they can't cut in that particular area anymore because there's too much scar tissue that's developed. That scar tissue becomes hard. It can also definitely create some problems for the body. Now, the good news is, and there have been people that we've been blessed to be able to support that were considering surgery, and then we were able to give them what it was that they were ultimately needing, and they got the resolve that was necessary, and then no longer felt a need to have the surgical procedure because they were good at that point. There's also been situations where I can think of a case off the top of my head right now where a person was considering surgery, had a conversation with them, said, well, you know what, there are a lot of people that are getting paid as a result of this surgery. I think I don't want to let them down. I think I'm going to go ahead and do it. That was what the person actually said to me. I mean, it's his body and it's his choice, obviously. Um, Charles Butler and Mariana Gilmore, greetings to you both. Good to have you here. Um, and so he went through the surgery. It was a surgery on his shoulder, if I recall correctly. It was his right shoulder. I'm actually touching my right shoulder, although on the screen it looks like my left shoulder because StreamYard, which I'm doing this broadcast through, flips everything. But at any rate, he had. I told him, well, if you want to have the surgery, that's fine. Let's work together after you have the surgery to improve your recovery rate. To help with your recovery after you have the surgery. Okay, and so he did that. After he had the surgery, he was in a lot of pain. They told him that he was going to go through that the recovery process was going to be long and arduous. That he was going to have to um, go through several months of physical therapy and occupational therapy, and you know he was understanding that that was going to be a lengthy process. We got together. We did one session. We did one session. Um, it had been very difficult for him to even move his arm, and by the end of the session, he had full range of motion, and he was fine. Uh, he went to his appointment, and the doctor who was examining him in his follow-up appointment, he was handling his arm very, very gingerly because he was expecting that it was going to be a lot of pain, any movement of his arm, anything that caused any movement to take place in his shoulder. And so he was handling it very gently to see how much he could handle. And then the gentleman himself said, "Why don't you just move it all around?" And he did that. And the doctor was blown away. And he was definitely not expecting that. Called another doctor in, to take a look at it, and that doctor was blown away too. All right, and so he ended up saying, "Well, you're not really going to need the therapy. I mean, you can come if you want to." Um, but I mean, really, there doesn't appear to be any need for it because you seem to be quite fine with a full range of motion and a good amount of strength in your shoulder, and you're not feeling any pain. I can't explain it, um, but you definitely seem to be in much better shape than we ever expected you to be. And I don't even know how it's possible, they said. But the reality was that there is more available again than what's out there. Doctors can only tell you what they know. They can only tell you what they know. They can only do what they know to do. All right. And so I will share with you that many years ago, I had the opportunity of training with this brilliant, brilliant man from China, beautiful soul, brilliant mind. Um, and he seemed to very readily and easily know the cause of every sickness and disease that a person could experience. And I saw him firsthand resolve situations with people on the spot and end up being blessed to train with them. Um, and now I get to train people and how to do what I do. Not exactly what the way that he was doing it or the way that he does it, but there's some things that I took from training that I received, and also things in terms of understanding the DNA, and how things are passed from generation to generation and different genes that exist and such. And took those things that I had learned from these others and heard from God on uh, what to do in terms of developing another methodology. And I was blessed to do that and to be able to share and teach that with other people, share that with other people and train other people to do it. And just again, wanting to touch base. I've seen a few people comment that I hadn't seen comment previously. We're on both YouTube and Facebook, and we're on Facebook in a couple different places. Is there anybody who's experiencing any physical pain at all right now? Anybody who has any pain that you're physically experiencing right now at all in your body? Or if there's somebody close by who has that you care about who has some physical pain that they're dealing with, regardless of what the cause might be. I've dealt with folks with broken bones before, people who still had a bullet in their body, people who've dealt with people who had surgical procedures done, having, lumps removed without ever having to take a pain medication because of the work that we did. There are a variety of things that people end up experiencing pain in connection with physically. But those things can be addressed in powerful ways. And I'm happy to share that. And believe it or not, you can help a person experience that too. Some years ago, there was a person in the class. It was actually a small training. There were just a couple people there, and I invited them to invite people that they know who are experiencing pain in this 3-day training. Uh, and this is the late afternoon on the second day of a 3-day training. And I always tell people, you know, by the afternoon of the second day of training, you'll be able to do what I do. Okay. The reality is, I'm blessed to do this, but the magic, the power, it doesn't exist in me exclusively. Okay. This is, I believe, a blessing uh, that God has allowed me to be able to implement and to share with other people. Via treatment as well as training. And just like a light switch, I'm not the person who invented the light switch, but I flick it and it goes on just as well for me as it would for the person who invented it, right? And it's similar with this methodology. Anybody can do this just as well as I do. Okay. I can't take the credit for it. I happen to be a person that this particular methodology came through, but it didn't come from me. I say that it came from God. And yes, there are things that I learned. Yes, there is a science that is connected with it. Yes, there are certain things that are going on biologically and physiologically and quantum physically. There are things that are going on spiritually. There are things that are definitely taking place um, that I can't take credit for, but I'm very glad to be able to share this. And you can access this too, and use it for your empowerment and for your well-being and that of others. Okay, whether you are in the medical field or alternative medicine or just that you care about people, you can utilize this and benefit people with it as a result. So if that's something that you're at all interested in, again, feel free to reach out to me on Facebook at Royce Fletcher Thomason. Do me a favor though, please send me a friend request because I learned earlier from Curly Conscious King that a message was apparently sent, but it didn't show up in my regular inbox. So I'm going to have to check and see if there's some other, and I do believe that there are occasions where something might go to some other folder. I had somebody send me a message they sent it on Facebook Messenger, but it showed up in some kind of hidden folder in my Instagram account. Don't know how exactly that happened, but it did. Fortunately, we did end up communicating and speaking. But I wanted to say for anybody out there, please know that you are loved, that you are worthy of love, that you are worthy of having your body temple feel good, that you're worthy of good health and a sense of wholeness, that you don't have to struggle with physical pain. Again, the doctors, not necessarily that they're, you know, ill intentioned, but they can only share with you what they know. Okay. I know there have been a lot of people who've been told you're going to have to live, you're just going to have to learn to live with this pain. And the reality is that people don't. And I've seen it thousands of times where uh, somebody was able to just experience something very different, where people were able to experience something very different. You may be considering some surgery, but that might not be something that you have to do. You know, the reality is when you go through surgery, there are a lot of things that happen in the body besides the things that I talked about earlier in the scar tissue. You know, the way the body is designed, and this body, it is so beautiful. Every human body, some we might not think look as pretty or as handsome as others. Okay, some may not be as fit as others. But the reality is that every body is a beautiful mechanism. A human body is a highly complex organic machine, a highly complex and profound, beautifully designed biological mechanism, right? And the way that it works is so phenomenal. And there's this continuous flow of things that are going on right now. Right now, there are things that are going on in your body that you have no idea of, and they happen without you even needing to think about it. Somehow you eat a piece of fruit or a piece of chicken or a hamburger or whatever it is that you put in your body, and then that goes down into your intestines. The plasma in your blood draws out the nutrients from your intestines, from the food that you've eaten that's been broken down in your intestines, takes it to every single one of the trillions of cells in your body. You got like a million cells just in a single fingernail, to all of the trillions of cells in your body. And then it takes the waste from each of those cells from that cells and then eliminates it from your body. Okay, you've got your circulatory system that's a flow of energy. You've got your digestive system that's a flow of energy. You've got your nervous system that's a flow of energy. And we're not always even aware of all the stuff that's taking place in your body. But when you have that type of trauma to your body, such as a surgical procedure, what happens in that context is that there's an interruption or there's damage that's done to that normal flow. Okay. Now we know that there's things that are flowing in the context of your nervous system, but there are also invisible things that you don't necessarily see. There are meridians in the body, lines of pathways in the body through which energy moves and flows, right? When the body runs out of energy is when the thing that happens that we call death, right? And the energy flows through these meridians in the body. A lot of the issues that we have in our body is a result of blockage or congestion of energy, where the energy in our body isn't able to flow. Okay, it could be from emotions that we've got locked up that we've not processed that can cause, different issues and challenges. But when the body is cut on in some type of surgical procedure, what it does is it can create a misalignment, and an interruption to the flow of energy that's passing through the body via those meridians. It can throw everything out of whack. And that is connected to some of the challenges that a person faces in recovery from surgery, or some of the things that a person experiences when they've had some injury to the body. And, you know, popular medicine doesn't really address that sort of thing, but it is something that is very much real. And so, whether a person is having surgery or not, uh, utilizing this sort of thing is something that can be very, very beneficial to a person and their overall well-being. Okay. So I just want to share that again. If this is anything that's interest to you all, or again, if hello Dorothy Scott. Again, if anybody out there is at all interested in uh, having some pain relieved right now, let me know because we're about to close this down for the day. But if there is anybody experiencing physical pain and you'd like us to address it, let us know now and we can address it on the spot real quickly. Otherwise, anybody who's interested in learning more, again, reach out to me on Facebook at Royce Fletcher Thomason, or on Instagram at Royce Fletcher Thomason, or Instagram at Transcending the Matrix. Um, any of those ways can work. If you do reach out to me on social media, you may want to send like you may want to follow or send a friend request, because I think that may show up a little bit differently. It may go to my regular box, but I'll make a point to check for these quasi hidden mailboxes too, as I learned as a result of a message that somebody recently sent me. All right. So for all of you who are out there today, we appreciate you stopping by. We hope that you learned something that you found useful. We we really do want you to be empowered in your life in general, certainly including your health. You know, so often people work so hard in their lives to make as much money as they can, to have the best possible lifestyle that they can. And they sacrifice a lot of things in the process of that. And one of those key things is their health. And then a person will spend all the money that they have to try to get their health back, or to restore their health, or to feel better because of the challenges that they're facing. And this is a way that you can have an empowered position in your own well-being and in your health, and where you can help others as well. So again, I'm Royce Fletcher Thomason. I'm glad to share the love, the light, the information, and I pray. In fact, let's do that right now. God, thank you so much for everybody who's come by here today. Thank you for the journey that each and every one of us is on. Some of us might have a different journey than others, but we're all on a journey. We're all trying to figure out this thing called life in the process of living as spiritual beings in a physical body. And while we're doing so, we pray that we might have the grace to get through it successfully and effectively. Allow us to be able to expand our awareness, our minds, to be able to see where it is that you're guiding us and directing us. Allow us to be empowered. Allow us to be able to discern clearly that which is for us and that which is for us to do, as well as that which is not for us and that which is not for us to do. Grant us the courage, the determination, the discipline to take on the work that we're called to take on. Grant us the serenity to accept the things that we cannot control and the things that are not ours to take on. And God, grant us the wisdom to be able to discern the difference between the one and the other. And allow us to be able to really, genuinely be true to ourselves, be true to who we really are, to be authentic in who we really are, and to be fully self expressed in this course of living life as human beings on planet Earth, journeying toward a sense of self actualization and a desire to reach that very achievable experience of the sustainable state of supreme satisfaction. May heaven exist in all of us, and may we know that that's to be found in you, beyond anything that exists merely physically. And for this opportunity to be able to share this love, this light, this insight, this gift, I'm ever so grateful, God. And I pray that each person who sees, who hears this broadcast, whether live or in a playback, that they find and experience themselves as being very blessed, that they know that you are bigger than any problem, and you are the solution to all situations. And for this, we give great thanks in Hashem Yeshua HaMashiach Ashe and Amen. All righty. Fatina Scott, blessings to you, my sister. Curly Conscious King, Dorothy Scott, Mariana Gilmore, Charles Butler, Kenya Cook, and everybody else who stopped by today. I wish you peace and love. And I hope you have an awesome week. God bless you and look forward to seeing you soon.